Hi everyone, my name is Wade Cosplay and I'm the website information officer for MyCP Guide and board director at Cerebral Palsy Australia. Welcome to today's webinar, during which we'll talk about how individuals with cerebral palsy and their families can access the right hospital care and accommodation when they need it most. First, I'm just going to start our session today with an acknowledgement of country. I acknowledge that I am hosting this webinar from the lands of the Boomerang people of the Kulin Nation. I also acknowledge the traditional custodians of the various lands on which you all reside today, and any Aboriginal and Torres Strait Islander people participating in this webinar. I pay my respects to elders past, present, and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures. A few things to note quickly before I introduce our presenter today. First, today's session is being recorded to publish later on the MyCP Guide website. Attendee names will not be visible in the video recording once it has been uploaded to MyCP Guide. So for anyone who may have concerns about identifiable information, please be assured that you can take part in the later Q&A segment and you will be anonymous in the published recording. For the Q&A segment that follows this presentation, we encourage you to submit any questions or comments you may have for the group by clicking the Q&A button and submitting your question there. Please note that attendees' microphones are muted by default throughout the presentation. So if you have an accessibility need or preference to ask a verbal question instead, please click the raise button with the hand icon so that we can unmute you. Lastly, if you wish to use closed captions in this session, go to the top menu and click More, then Language and Speech, then Turn on Live Captions. Again, that's More, then Language and Speech, then Turn on Live Captions. Now, these are automatically generated captions. They're provided in real time by Teams, so they may not be word perfect, but they're actually pretty close. So now to the big event. Today, we're very excited to have Dr. Sarah Everitt, who's Managing Director and founder of MediStays, Australia's leading accommodation and care service for people on a health or disability journey. During today's webinar, Sarah will provide her insights for what people with cerebral palsy and their families should consider when preparing for a journey to the hospital, and also the supports they might require during their hospital visit. And lastly, planning for recovery and life after discharge from hospital. So, Sarah, I'll hand it over to you. Thank you.
Thanks so much, Wade. I'm absolutely delighted to be here and to have met Wade at a remarkable event run by Cerebral Palsy Alliance, where we connected and have been having this discussion since. So I'm just going to share my slides now. If you can see them here. And as Wade, you can see those okay, Wade?
Yes. All
great. Good. Thank you. Thank you for the introduction as well. I hope the information today is helpful and practical. As Wade knows, I'm not a specialist or an expert in cerebral palsy. The information that I'll share is information gathered from our community who utilise MediStays and is very general in nature, understanding that CP is such a diverse condition with such a broad range of presentations and considerations. And so this is very general, but I hope within the course of the session that you can pick up some helpful tips as well. Like Wade, before I begin, I would like to acknowledge the traditional custodians of the lands where I'm presenting from, with the lands of the Wurundjeri and Woiwurrung people, and to pay my respects to elders past and present and any First Nations people joining us on the webinar this afternoon. As Wade mentioned, I'll touch on several parts of a journey of somebody with CP and their family or carers who are on a journey to hospital. And again, this is very general in nature. They may be travelling just a short distance or indeed very long distances. And we do find that patients in Australia are presented and faced with the situation where they are often required to travel very long distances to access specialist care, whether that's CP or whether it is for somebody living with a diagnosis of CP but having other forms of medical or specialist care. We'll also have a chat about supporting a person with CP during a hospital visit, specific considerations for patients and families travelling from our rural and regional communities, and then some extra things to think about in terms of where people are living after a complex hospital admission, and also respite and the importance of respite breaks for the carers. Wade and I have had some terrific conversations in recent times about my CP guide and the role of individuals living with CP and their families and carers. And I explained to Wade that my background prior to MediStays was actually in cancer and oncology, and I worked at a specialist hospital throughout that time. And really the point that we were discussing was that there are so many complex health diagnoses that people are living with. Oftentimes an individual may be living with multiple diagnoses and considerations, and it's essential that as an individual you are advocating on your behalf, because for a diagnosis like CP, even though there are many people in this community living with CP across the general population and in some health and medical precincts, there is little known about this diagnosis. And so I thought it was important just at the start to touch on that if you're living with CP or visiting a hospital, to really be empowered to advocate on your behalf. And that just means ensuring that the people that are providing your care understand your individual needs as they relate to CP, and therefore that is an extension to promote your rights and really to have everything considered that you wish to have considered in your journey and the management of your health and medical situation. The other overarching theme of my presentation today is the importance of time. And for anyone travelling to a hospital, whether that is 50 kilometres or 500 kilometres, there are so many considerations that take time. And for somebody living with CP, particularly those living with more complex physical disabilities, communication challenges, everything is going to take a little bit longer. And that is for the individual and for their carer network. And oftentimes we find at MediStays that the person providing the care will take on this role of finding the right accommodation, organising the travel, figuring out where to park the car, advocating on behalf of the patient at the appointments and so on. And it really takes a lot of extra time at each point to find that accommodation, to know how that travel will be undertaken, just because of the additional considerations for CP. So by planning it out where possible and ensuring that additional time is allocated for each of the processes, whether that means allowing, an extra day of travel so that you're there and just relaxed and prepared the day before. It can help to preserve everyone's energy. It can help with the ease of the procedures happening in the hospital, and so on. So there's really many, many benefits of allowing for that extra time and not feeling rushed or pressured. And as Wade has shared with me, it can also have additional benefits in terms of your individual reaction in those processes, which we'll talk about. Wade also kindly shared this data here because we were talking about really the origin of MediStays, which is to break down the barriers for people travelling from rural and regional communities to access specialist care. And we know that irrespective of the diagnosis, whether it's CP or cancer, there are greater barriers for people that are needing to travel. And as an impact of that impacts people's quality of life and health outcomes. And you can see from this data presented in the Cerebral Palsy Register from 2 years ago that this is for children with CP. Almost 30% of these children are living in rural and regional communities. So for those families travelling, whether it's for specialist medical appointments, it might be allied health, it might be to access assistive tech, there's really an additional layer of complexity involved in accessing health and hospital care. So the first one is to think about the right accommodation, and we tend to view this in 3 different scenarios. These are really, like everything and like a CP diagnosis, there are so many variables, but the 3 most common scenarios for finding the right accommodation is to first establish who is staying near the hospital or the facility, and that is often a person with CP staying with one or more family members or carers. It can also be a person with CP staying alone, or it may be a family or carers staying in accommodation near a hospital while the person with CP is admitted for some more complex procedures. And for somebody admitted to hospital, in our experience, that can range from just 1 day to many months, to sort of 4 to 6 months, depending on the reason for the admission and the procedures taking place. So that there is that to consider. And then based on that information, that flows on to the types of accommodation that can be best matched for people. So the idea of presenting this is just to have really practical information that will help to support what you already know. Generally, the types of accommodation near major tertiary hospitals and specialist clinics are commercial hotels and apartments, and also in some cases, patient lodges. For CP, there are less patient lodgings available for just attending a hospital visit, but there are many hotels and apartments and many with accessibility. In terms of accessibility, at MediStays, we generated our own model and access criteria back in 2020 to help align with those traveller types. And in general, Access 1 is for anyone ambulant who can have a shower in a walk-in shower without any assistive tech. If it's in an apartment style or self-contained property, it has a standard kitchen. And then Access 2 and 3 are divided into separate categories. So for those where the number 1 criteria is the bathroom. So if somebody with CP is staying with family or carers, and they were a wheelchair user, for example, then it would be absolutely essential that that bathroom was wheelchair accessible. But in that case, the other aspects of the property don't necessarily need to be accessible. They don't require a height-adjusted kitchen. But for somebody diagnosed with CP, living with CP, who is travelling alone, completely independent and using a wheelchair, for an extended period of time, it would obviously be essential for them to have a completely accessible property to stay in, including the bathroom, but also the kitchen for their meal prep. The other decisions to be made in deciding on the right accommodation are the arrival and departure date, and again, just with that consideration of time, to give yourselves enough time for ensuring that everything else flows well. Oftentimes, hospitals in the city have no consideration of the time of the appointment for somebody travelling from the country, which can result in country patients getting up at the very early hours of the morning in order to travel. And invariably, that means that they're not sleeping very well that night because they know at the back of their minds that they have to get up so early. So that really translates to being pretty exhausted the following day and for a couple of days as well. So a little bit of extra time can be given just for the travel, and that is very helpful. The cost is another very important consideration, particularly for people and their families living with CP, where a carer may be a full-time carer or a recipient of the disability support pension. Then financials and the financial burden of attending medical appointments is a really important consideration. And I'll go through some helpful resources for that. Also, the proximity. So again, depending on the diagnosis and the level of accessibility, this is an important consideration for many people living with CP. And parking, because if you're using access aids, then you are likely to want to have car parking close by. So lots of things there. And on our own site, we've gathered a lot of data and information to build this out. And I have to say, we're in the process of rebuilding our website. So this will be changing this year, but the data on the left-hand side is driven by user data, and these are the most popular things that people are wanting to know. So in addition to parking and really practical considerations, that's about the bedding configuration. For example, if somebody CPs is staying with a family member but not in the same bed, the property amenities and the physical and sensory accessibility considerations as well. Our role at MediStays in verifying accessibility is absolutely essential for our community and for people using our service. If it wasn't, they would probably just jump on to Expedia or Booking.com and trust that process. But none of those websites verify the accessibility. It's measured and inputted by the staff on the ground. And for people travelling to hospitals, that's often not accurate. So on our side, this is Ash, our accessibility reviewer. Ash lives with a diagnosis of Friedreich's ataxia, which is a progressive disease. And so she is a great member of our team to go out and really visit the properties from the perspective of somebody who is dealing with accessibility on a day-to-day basis. And this includes general accessibility and considerations about car parking and flooring and so on. And we're really with a focus always on bathroom accessibility. That's always a very important one for us. And we break this down further just to help explain with visuals what the different types of bathrooms are. So it looks quite self-explanatory here when the diagram is helping, that this hospital style bathroom on the left is very open with a roll-in shower with lots of circulation space, which is required by some people. The 1 second from the left with the walk-in shower is the most popular option for many people with CP coming to MediStays, because they may be using a wheelchair or perhaps a walker for assistance. They're not requiring all the space, and there is just a preference oftentimes to have things a little more closely spaced. So the glass divider there, ideally with a grab rail, but also with the wall, just for balance. In the roll-in shower example, it can be so spacious that actually if somebody loses their balance a little, they can actually fall more easily. So that's very based on the individual requirements and the assistive tech that they have, whether it's a shower chair or even a stretcher, shower stretcher. The other two options are the standard shower, which is different to the walk-in. The walk-in has the integrated tile base with no lip, whereas the standard shower has a lip at the base of the shower. And then occasionally there are requests for a bath, but that's most often for children. And then for people with very high physical accessibility needs, we provide these measurements and a full OT assessment with all of the measurements, particularly around the distance of the toilet to the wall and the back of the toilet for people utilising a commode over the toilet, also the shower and the rails with the shower chair there. So it's just taking each level of accessibility to the next level. And this one here is particularly important for the people that we assist who are moving out of hospital, because they do have very high accessibility needs, and it's essential that we know and trust that this is a safe transfer and that the features of the property are offering the right facilities. Just to switch gears here now into financial assistance. So for a diagnosis of CP, for somebody that was travelling to a specialist hospital, there are in every state and territory subsidies available to help cover the costs of accommodation and also transport. It varies significantly across the jurisdictions, and an in-depth guide, you can jump onto the website and find that. But what we find, and the reason for sharing this today, is that most people contacting MediStays, and many who have been within the health and medical system for years and years, have never heard of these schemes. And so it plays a really important role in us educating our community about the patient assisted travel schemes, or PATS. The schemes are divided up by state, and each one has a different name or acronym. So for everyone in Victoria here, it is VIPTAS. Other interstate locations for New South Wales are IPTAS or PTSS. In Queensland, PATS and IPTS and PTAS, but some combination of patient assisted travel scheme and their state. And the amounts of the subsidy do vary. So they are not intended to cover the costs of the accommodation or the travel. And certainly in the case of Victoria, to be honest, I'm not aware that the VIPTAS rate has been changed for at least a decade. And so what you can see here on the graph on the left is the subsidy for a single patient. So if you're living with CP and you need to travel from a country area in Victoria to a hospital in the city, your subsidy will be $45 a night. For anyone who has stayed in Melbourne in recent times, you probably can't find a hostel for $45 a night, perhaps not even a car park near a big hospital. So it is, whilst it is supportive, some of the other states provide far more subsidies for their communities. The graph on the right is for a patient and a carer. And if you're travelling with a child, this usually covers both parents. To stay in the accommodation. Also to add, for people travelling with the patient, the subsidy will cover the person staying nearby while the patient is in hospital. The Tasmanian subsidy is the highest for families. The Tasmanian government provides additional support for families that need to travel interstate for specialist care. So they operate with two schemes, intrastate and interstate, as do WA as well. And for families in WA, travelling such enormous distances within their own state down to Perth, but also they are required to travel across to for some procedures in Sydney and and Melbourne. So if you are working with a community who are needing to travel, or you're living with CP and are needing to travel, please find out about these schemes. Whilst they are unlikely to cover the whole cost, they do absolutely make a difference, and they also include the petrol and travel costs. In terms of eligibility, each state and territory has very different rules. In Victoria, the minimum distance on Google Maps is 100 kilometres from your home to the hospital. States like Queensland, the distance is 50 kilometres. So again, you just need to be across the different eligibility. The other major difference is that most states except Victoria will pre-approve, and that empowers patients and families so much when they are deciding on the right accommodation, because they're confident that they either will or will not be approved for the subsidy. For people in Victoria, they need to apply for the subsidy after they've travelled. So they've already needed to decide on the accommodation and pay for that accommodation. And for some people, that does mean compromising on perhaps the optimal accommodation situation for them if they're a little bit uncertain that the subsidy might not be covered. So just another thing to think about in the planning. Oops. Just moving on to preparing for procedures. So again, really varied needs of people living with CP, but it's very helpful to think about your individual situation and what might help prepare for the process and the travel, but also during a specific procedure. And Wade and I had a chat about specific medications that would be prescribed for people living with CP. For example, in the situation of experiencing a spasm or pain control, also overlaying that with the knowledge of the actual procedure and the specific preparation required, and to ensure there's no contraindications for that. I'll touch on that more. Also, accessibility within the hospital and transfers and the procedure itself. So with the preparation phase and the medications, it's something that we recommend that you discuss with your doctor and medical team. Essential to ensure that any medication wasn't going to be contraindicated by other medications used during the procedure, but also, again, with the advocacy hat, ensuring that you know your body and your experience, and that if you think that a spasm may occur during a procedure, then please share that with the team. If you're going to a large hospital or a radiology clinic or something like this, they're generalist departments. They're not just focusing on one diagnosis or another. So you'll provide them with really helpful information that they need to know to best support you during the procedure. Also, the communication. So things like speech generating devices, eye control, switch and gaze control. Again, really important. They will take more time, but they'll ensure that everyone is prepared and fully communicated and understanding with that informed consent. And also during a procedure. So if you're undergoing a scan, for example, or a treatment, how could you actually call out for help from the team if you need it? In terms of accessibility, again, thinking about what are my individual needs when I go for this procedure and what might the hospital be used to doing. So things like a hoist. All hospitals would have a hoist, but is that even close by in the department that you're visiting? Perhaps it is, but it will just take an additional time factor to ensure that it's there. Should you take your own sling? Can you be lifted up? All of these sorts of accessibility considerations are really important for you to think about and to inform the team, if you can, prior to the procedure or appointment. And also for many procedures, as I'm sure you've experienced, they will have standard positions. So if you're living with CP and you're unable to lie in a particular position that the staff would be used to, how does that affect the procedure that you're having? Perhaps it's a CT or an MRI scan, and you're required to be imaged through the bore of a tunnel. Are they using specific equipment that needs to be modified in order to ensure that you're comfortable and lying still? Because you need to be comfortable in order to lie still in order for them to acquire the most accurate images. If you're uncomfortable or in pain and you're moving around, then that will actually potentially compromise the quality of the scan. So again, just really important things to think about. Just mindful of the time, but preparing for a hospital visit is also something that can create quite a lot of anxiety for everyone involved, and that includes people living with CP and their carers. So we know that people living with CP are often living with other diagnoses and health complications. We also know that around 1% of the overall population are living with autism, but this is much higher in people with CP, and based on the data we have access to, it's around 6%. So a visit to a hospital is really can be quite overwhelming, but there's some brilliant tools available, and I'm thrilled to share this one with you today. It's just been released. Earlier this year, we undertook a collaboration with Tom Melbourne. If you don't know of Tom Melbourne, look them up. They're such a wonderful organisation creating solutions for people living with disabilities. And also the cohort of architecture design students at Monash University. So the brief for the students was to create solutions for people living with disabilities who are staying in short-term accommodation or respite. And a group of the students, one who has a direct connection to somebody living with autism, created this absolutely marvelous map. It's printable on fabric or paper, and it enables the person and their carers to create this visual voyage. So from everything to mapping out how they would travel to the hospital, who would be attending to the visits, what they might like to take, are there security things that they would like to have with them, all the way through to what to do during the hospital, how they would like to be communicated with. So I popped the link there. This is freely downloadable from the Tom website. It's all open access, open source, and it's a really wonderful tool. Again, just feel free to use that with your community. I'd also like to touch on NDIS funded services. So excuse me, with the PATS subsidies that I mentioned earlier, those subsidies are just to help cover the cost of travelling for specialist medical care. I should have mentioned as well, if there are any researchers on the call, research trials and clinical trials are generally an exclusion criteria for PATS. But also, if you are undertaking a trial where you're enrolling people living with CP, please have a think about including this into your grants, because again, it's just not something that is really commonly known about, but can really make a difference to people. In terms of NDIS funded services, the NDIS doesn't cover the cost of accommodation travelling if you need to attend a hospital visit, but there are other types of accommodation that are used by people, funding used by people living with CP with their NDIS funding. So this includes medium-term accommodation, specialist disability accommodation and SIL, and also short-term accommodation. And I'll just touch on these as well. So NDIS funded medium-term accommodation is generally provided for up to 90 nights. And it's for people who are either medically approved for discharge. So for people with CP, that might be related to a CP-related admission or something linked, for example, a really serious fall, an admission to an acute ward and a rehabilitation stay afterwards. And at some point in that admission, the patient will be approved, medically approved for discharge, but they need to, there is a stepping stone to return home. So Perhaps their home is not accessible. They might have steps that they're no longer able to navigate, or a shower over the bath, and they're unable to return home, but they don't need to stay in hospital anymore. So MTA would be funded to support somebody with a transitional stepping stone of accommodation so that they can safely leave hospital and return back to community. They would oftentimes be matched with 24-hour supports from disability support workers, and they would also access allied health professionals either in the MTA accommodation or in community. So this is a really important funding stream and support for people who are able to have MTA built into their NDIS plan, and it must be a stated support. The other common use of CP, of NDIS funding, is for CP-related home modifications or disability-related home modifications. So perhaps you're living with in a situation where your mobility is decreasing. This is a picture of Ash's bathroom. She recently had it modified, and it was just creating a really unsafe place for her to shower and undertake self-care. She wasn't able to use the shower. She couldn't hop into the bath, and she also couldn't access the taps on either side of the sink that you may be able to see there. So she, in a worst case scenario, this would have related into a fall and possibly a hospital admission. But you can apply for medium-term accommodation to provide you with somewhere safe to stay during home modifications and while the building works are undertaken, so that you can move back home. The other NDIS funded support is just absolutely wonderful and so important for carers, because the carers are providing informal, unpaid 24-hour care for your loved one living with CP. And in order to sustain that living situation at home, it's really important that you access some short breaks to recharge. So under this NDIS funding, this is funded under core supports. Participants are able to access up to 28 days every calendar year, and the eligibility is for somebody living with informal carers such as family. The Cerebral Palsy Alliance we're partnered with provides some wonderful options for this respite accommodation in Sydney, and we have options across Australia, but they're really safe, set up for the person to stay in while their family are resting at home. So I might just finish up there for the Q&A and to stop sharing my screen. There's also, feel free to jump onto our website for any of the resources I've mentioned today. You can find those there.
All right. Thank you very much, Sarah, for all that information. A lot of the funding I wasn't aware of, so that's really, really good to hear. And so, again, if anyone has any questions, feel free to pop them into the Q&A chat, and Sarah can answer those. Alternatively, if you want to verbally ask a question, just hit the raise button in the toolbar and we'll unmute you. Sarah, you touched on a couple of points related to the medium-term accommodation. So from what I can tell, that all has to be kind of put into your plan ahead of time, right? So, for
Yes.
example, if you needed emergency surgery, say due to a fall and you broke your hip, that wouldn't necessarily be available for funding.
No, so it would be applied for when the need arose. It's quite a complex funding line, and the criteria are very strict for the medium-term accommodation. It has to be fully approved in the plan. Generally, the eligibility are that you need the MTA to have safe accommodation during the home modification so that you can return home, or that you're unable to return home due to your high support needs, and that you would, rather than returning home, move into some specialist disability accommodation or supported independent living. And so that would be the natural progression for that. Yeah, but it wouldn't
Okay.
be used in a crisis. It's
Okay.
more that during the hospital admission, a application would be made for MTA.
Okay. Okay.
Yeah,
And then that would need to be approved. Yeah, okay, in due course. Okay,
yeah,
I see.
yeah.
I see. So, and a lot of things you touched upon in the beginning, as far as um, medication and um, also with food you might need, or drinks, or whatever, because not only for a scheduled hospital stay, but also I know, so I've had more than a few times a ride in an ambulance, not necessarily because I really needed one, but there's no alternative. If you're bleeding, you're on your own. You're not going to be able to get a taxi or anything to take you to the hospital. So your only alternative is ambulance, and then you have to wait in ED and all that. So I think it's important for people with CP to realize, or just to, if they can, make sure that ED might take hours. So if you can, get your appropriate medication, food, hydration, whatever you usually need. I know because you're going to ED, it might be difficult, but if you can reach out to a friend or parent and say, yes, I really need this, and make sure it's there with you, because otherwise, in the ED, they're fairly, from my experience, fairly unaccommodating to your specific needs because they're a general hospital. So that's really important to take into consideration as well.
Yeah, that's such a good point, and I think we discussed that the other day, and I've missed it absolutely. The hydration and the snacks, you can end up in the hospital or the appointments for a very long period of time. And the other one was in staying in the accommodation. If you require a modified diet or pureed, so it's common for people just to bring their own food processor or blender, things that you know yourself will make that journey easier and appropriate, so that you're not just having to go out and to try and find that. It's all that time and preparation in putting in, if you have the opportunity, not in that emergency situation like that. So
Yeah, that's a really good point, Sarah. Especially, I guess in your short-term accommodation, such as the blended food. These are things that you need on an everyday basis, pretty much. So you would want to make sure, yeah, it's short term, but I'm gonna need to think of everything I need for everyday living
yes,
in that accommodation. Yeah.
yeah, definitely.
And Natalie actually asks, what advice do you have for emergency visits to hospital? Natalie, I share mine for people with high support needs. Sarah, do you have any advice on what they might consider for that?
For high support needs in an emergency department.
Mm-hmm.
Yeah, I think as well that the advocacy is so important to share your individual needs. Again, it's even though we would love to think that everyone had the understanding of each patient coming into that environment, the needs are so diverse. So it's very important that you're advocating on your behalf. And that could be really difficult as well for anyone on the call that has been in that situation. But that is really important, particularly around those basic needs of hydration and meals and so on. Um, and just to make them aware, if you've been in an emergency situation, but you have medication that you should be taking, things like this. This scenario happens with other diagnoses like diabetes and all sorts of things, then it's important to think about just to make them aware so that you're safe. But it's a tricky one, those unplanned emergencies, especially if they're from a distance.
Yes, it is. And just, I would suggest this thing out on the top of my head that, it might be actually beneficial if you kind of make a list, almost have like a emergency kit as well, similar to what people that do it with, natural disaster emergencies. Make sure
Yes.
you almost have a survival kit, if you
Yep.
will, for going to the ED, and that might be something that really helps kind of be proactive and also develop or write down what you actually need so that can be handed to the front of house staff within the ED as well.
Yes.
We have a couple of hands up. Freya, I have made your mic. You can unmute yourself.
Yep.
You should be
Okay.
able to unmute yourself to ask your question.
Thanks. I suppose it's a bit more of a comment than a question. Similar to what Wei was just saying. I've been in hospital since June 2nd, unfortunately. And I'm still in hospital. It's lots of fun.
Freya.
But a couple of the things that I've learned during my stay in hospital have really been around the difficulty with accessing NDIS supports in hospital,
Yes.
and the importance of being able to access my NDIS supports, because my disability doesn't go away just because I'm in hospital, and the
Yes.
nurses aren't, they're able to help me with my health stuff, but they're not necessarily able to help me with, accessing my computer, for example, and
Yes.
like they'll open it, but they can't sit here and help me with that sort of stuff. So these are the things that I would recommend people think about before, I mean, I had a fall. It was an emergency admission, like it wasn't a planned admission.
Yes.
And the other two things is, as Wade kind of said, having a hospital go bag and stuff like that. Having information, having like having to think about how best to be able to access the things that you're able to usually do at home in a different setting. Like I've had to relearn how to do things in a way that work in a hospital. And that's been a bit of a learning curve, being able to access technology and that kind of stuff, which opens up, a lot of the world for me. But I think the biggest thing I wanted to touch on was a little bit about the disability liaison officers,
Yes.
which when I first went to ED, this lady came in. She said, "Hi, I'm such and such from the Disability Liaison Office," which is a service I'd never accessed before. Now I'm in Victoria, and I'm not sure if how common they are. It seems to be relatively common in the big tertiary hospitals. But I found that service has been really fantastic at helping me advocate for what I need. and making sure that I have access to the supports I need and information and training for the staff who often don't have information available to them on conditions such as cerebral palsy, because they meet so many different people. So having access to that service has been really fabulous in terms of my stay in hospital and in the rehabilitation hospital as well. So yeah, I guess those are just the kind of the three things I wanted.
Yeah, that's such great points, Freya, and thank you for sharing them so openly with the group as well. The hospital liaison officers or HLOs are great. As you say, that they're not in all hospitals, but I think for anyone, the topic of accessing your own disability supports and to have that continuity of care from your own supports back from when you're in the community is really important. And if you've got the HLO or support coordinator that can help you to ensure that those supports continue, then they're really important resource, human resources to tap into as well.
And those are really good points, Freya. Thank you again for bringing those up. And I'm also sorry to hear that you've been spending such a long time in hospital, but I hope you're on the road to recovery and can go home soon. One of when you were discussing the things that you were going through, as far even with communication and using your laptop or computer, another person I know that I had this discussion with, they said that when they were admitted to hospital, that one of the questions was, can you feed yourself? And they put yes, because they can. But then they said the question should be, can you feed yourself when you're in a body cast and lying flat on the bed? The answer would be no. So really think about, if you can, how you will be after rather than currently, because they do actually note, well, you did say you could feed yourself. So those are things to consider as well. Natalie, you have your hand up. Can you unmute yourself, or I'll try to?
Yeah, I've done that.
Okay.
I just thought of a few other points. And while I wasn't in hospital for as long as Freya was, I did have an emergency entry to a hospital. I was in an incredible amount of pain, so I did as much advocacy as I could. But a lot of when you're in emergency, you're often in so much pain you can't advocate. So,
Yes.
I was supposed to be in for 3 days. I was in for 17, including 6 in ICU. And part of that was because I told them I can't, when you give me pain medication, only give me a little bit, because it works so well that, you give me a little bit, that's everybody else is a high dose. They kind of listened to that until they gave me so much that I stopped breathing. So the thing that came across to me was that, and the things that came across while I was there, they in theory have a hoist. The hospital expects your carers to come in and provide the supports. The agencies won't do that because the insurance doesn't cover them.
No, they're
And
not allowed. Yeah, no physical hoisting.
it's not even the physical hoist. It's like, but you ask the nurses, oh yeah, they can come in and do that. And they just haven't got a clue. So, and I found out about the hospital liaison people afterwards. they're supposed to ring the NDIS to tell them I'm in hospital. They didn't. Nobody told me. And I know that there's things you can apply for in hospital, but, you know, if there's no emergency means I don't want to hear about it in 3 months after you've got 3 OT reports. You're being told the person is in hospital, get them at least some interim stuff for a month so they can sort themselves out. The NDIA doesn't do that either. And that's what's needed so that people can go into a MediStay or something or get some extra equipment until they can sort it out. So part of the problem is everybody says you can do all these things, but there's so many structural barriers you put in your way, nothing happens. Anyway.
Yeah, I'm so sorry to hear your experience, Natalie. That sounds dreadful. And like you say, there's many resources and many people, but they're working separately. And as Freya has mentioned as well, like I guess to clarify, our general understanding is that disability paid NDIS disability support workers can come to see you, but from a hospital perspective, they're not allowed to be doing anything like showering you or, you know, anything like that. So
and if the hospital was smart, if the hospital, you know, because of the risk, the thing is, if those carers have been doing it for you for a while, I'm not talking about a brand new carer who you've never met.
No.
Somebody who know you well and they're experienced in hoisting, I'd rather get them to do it than a nurse. They're safer. The other thing that I would recommend to people is, ever since my hospital stay, I now wear an emergency bracelet, which not only has emergency contact numbers on it and a reference to cerebral palsy, that's not the big, it has, don't give me this medication. Because if I'm unconscious or unable to speak, they see an emergency bracelet, they know to look at it.
Yes,
and it only costs me about, you know, $60 or something, and it's waterproof, it lasts for ages. So it's worth getting. I think it's Media Australia.
Yeah, it's a very good point, Natalie, because especially, you know, I mean, everyone with CP that's attending this webinar is well aware you can fall without warning and you know, you just don't know what the damage could be. So having something like that, like a bracelet, is a great idea, actually.
Okay.
Yes, definitely. And also just looking, so we have people also putting in the chat that, and this was on the news recently, that Scope produced, I think we got a visual thing for nonverbal people with disability that they can use for emergency care workers as well. So I think, I know it's here in Victoria. I don't know if it's national, but paramedic units will have those so to help people that have difficulty communicating, especially during an emergency. And someone also mentioned the National Access Card as well, so that might be useful. So, but this has been a really good conversation, and I think one that's definitely needed. And also, I'd just like to add from my own personal experience that even if you're going into hospital for what might be considered an outpatient procedure, what, you know, hospitals don't take into consideration is that for people with CP that are injured that have a procedure, even though it's considered outpatient, that is still, you know, introduces trauma, physical trauma to the body, and people with CP will react to that as well. So even though a specialist is focused on the operation or procedure and saying, yep, and then you'll be fine, keep that in mind and make sure that if it is an outpatient, that you might look at a hospital overnight stay just to make sure you're okay, or to make sure that you have friends and family staying with you, because as we all know, um, people with CP, that recovery time takes a lot longer. So that's another thing I would add to this conversation as well. So, but we're already over time, which I'm really not surprised because it's been a very interesting topic. And again, Sarah, one that I think was well needed, especially within the cerebral palsy community. So, again, thank you so much for your insights into this as well.
Thank you very much. I really appreciate the community and for so openly sharing your experiences from the people on the chat as well. It's really complex and we really appreciate you just sharing that so honestly. So I hope Freya that you're able to leave hospital safely soon. And thanks Wade and Evelyn for the opportunity to speak this afternoon. I've really enjoyed this.
And so have we. And again, thank you for your time and expertise, and thank you everyone for joining. And we'll see you during the next webinar.
Thank you.
Thank you.
Bye-bye.
Bye-bye.